So a lot of you are aware about the BBL surgery now. And I get a very common question, which is whether you can combine a tummy tuck with a BBL. Now let us see in this video what are the pros and cons of combining them together. When we are talking about a mommy makeover, obviously when women come to me, they discuss various parts and what they would like to be corrected. And breast and abdominal area is of course the primary concern. But a lot of you would want a butt enhancement along with your tummy tuck surgery. Now, when we see a tummy tuck surgery, what is done in a tummy tuck? Tummy tuck is basically removal of fat around the abdomen and then pulling the loose skin, removing the loose skin and tightening your abdominal area. Along with, of course, the resetting of the navel area in this surgery. Now, when you are undergoing a tummy tuck surgery, obviously, you will need to lie on your back and that will be your position of rest, either lying on the back or maybe on the sides. But you cannot lie down in the prone position. That means on your tummy. It is very difficult and not advisable, obviously, after a tummy tuck for you to lie on your tummy. Now, let us look at a BBL surgery. When you get a BBL, and I mean by BBL, a good volume of fat transfer on the butt area as well as the hip dips. So, when we are doing a BBL surgery, obviously this fat that has been injected in the butts, it needs to rest, and that is why we need to put it away from pressure. That means we have to lie on the tummy so that this butt area is not pressurized and the fat survival is better. But when we are doing both combined, obviously they are acting like opposites. With a BBL, you can't lie on your back, and with a tummy tuck, you can't lie on your tummy. So if you're having both together, what is the solution and how will you recover? That is why most of the experts around the world will not advise a BBL along with a tummy tuck. So when I'm talking about BBL, I mean significant volume of fat transfer. However, if you want fat transfer on the sides, that is on your hip dips, that can be combined with a tummy tuck surgery, and we do it in many of our cases so that the silhouette becomes a slightly hourglass and the waist is snatched, the tummy is tighter, and the sides of the hips also have a rounder form. But again, when I get requests where patients say that, doctor, we don't have time and we have only this much recovery days planned for ourselves, please try and do both together. You must understand that it's not entirely safe, because when you are lying on your back, this fat, obviously you can't lie on your tummy after a tummy tuck surgery. When you're getting BBL along with it, you will lie on your back. And once you're lying on your back, this fat will be pressurized. After it is pressurized, it will obviously move towards the sides. And when there is undue pressure for a long time, then obviously the fat survival will not be there. There will be fat necrosis and other problems come with it. So yes, if you want a small volume, maybe yes. If you accept that the absorption ratio will be a little more than a normal fat transfer, because this area will be pressurized. But you should separate the two. Now let us see that if you choose to do it separately, which way should it be planned? So definitely you should have your BBL surgery first, because whatever fat will be removed from the lower back, from the abdomen, all of it can be used to augment the hip and the butt area. And you should give it a sufficient healing time. You should lie on your tummy when you're resting and try to avoid sitting for at least 6 weeks as much as possible, and then let the area heal so that the fat take is much better. After about 4 months to 6 months, you can definitely plan your abdominoplasty or tummy tuck surgery. This way, you will have the best of both the results, and the change in your silhouette and in the shape of your body is going to be very pleasing. So if you are a candidate who wants both, then weigh your options first. But there are many women who want just a little fat grafting. That can be combined. It's not a problem. But if you're wanting a huge volume, my advice to you would be go for the BBL first and the tummy tuck later. So I hope that this video will clear your doubts about having these two procedures together. The cons are very clear. Less fat survival and obviously difficulty in positioning yourself, the long recovery time. So all this comes with it, along with an enhanced risk of embolism, because this area, the butt area, is also operated. So the moment it is pressurized, there are more capillary breakages that are going to happen. So best not to be combined together. If you have more questions around this topic, do not hesitate to write your comments in the comment box below, and I will see that I personally answer them. And if you have more queries, you can definitely reach out to my team and they will answer your questions. So I hope this video will clear your doubt about having a tummy tuck and a BBL together. Do subscribe to our channel and switch on the notification bell so that you can get notifications for the new videos. Thank you for watching.